Hey everyone, and welcome. Today we're pulling back the curtain on something a lot of us will go through, but maybe don't fully understand: the real journey to a successful surgery. We're going to explore all the incredible planning and the safety steps that happen behind the scenes to make sure everything goes as smoothly as possible.
So, let's just jump right in with a question for you. What do you think is the absolute most important part of a successful operation? Is it the surgeon's hands, the fancy equipment in the room? Well, the answer might not be what you think.
Because really, the foundation for a great surgical outcome, it's often built long before you ever set foot in the hospital. You see, a successful surgery isn't just one single event, it's a whole process. And that process starts with amazing preparation. And that whole process kicks off right here, with what's called the pre-op safety check. Honestly, the best way to think about it is like a pilot's pre-flight checklist. It's all about a systematic review to make sure the aircraft, in this case your body, is perfectly ready for the journey ahead.
This evaluation is all about getting a 360-degree view of your health. And the goal isn't just to spot potential problems. It's to get ahead of them, to manage any risks, and to make sure you go into that procedure in the absolute best shape possible. This makes a huge difference in having a good outcome and helps avoid those stressful last-minute cancellations.
So, how did doctors get on the same page about a patient's health really quickly? They use this system, the ASA classification. It's a pretty simple scale, from 1 to 6, that gives the entire team, from the surgeon to the nurse to the anesthesiologist, a super quick snapshot of your overall physical condition. It's a really powerful way to predict how well you'll handle the stress of surgery.
Now, to figure out how fit you are for surgery, it doesn't always take a bunch of complicated, expensive tests. Sometimes your doctor might ask you something as simple as this, and believe it or not, your answer tells them a ton about how well your heart and lungs are working.
And that simple question gets at the hard data they're looking for. See, being able to climb those 2 flights of stairs means you have a functional capacity of at least 4 metabolic equivalents, or METs. You can just think of 1 MET as the energy you use sitting still. So hitting that 4 METs mark is a really key sign that your body can probably handle the physical stress of an operation without needing a deeper dive into your heart health.
And this is where you become a really active member of the safety team. This whole optimization phase involves things like tweaking medications, making sure you're getting good nutrition, and making some big lifestyle changes, like quitting smoking. And the data here is crystal clear. Stopping smoking at least 8 weeks before your surgery can dramatically lower your risk for complications. All right, the pre-flight check is done, so let's head into the operating room. Now, we're not going to focus on the step-by-step of the surgery itself. Instead, we're going to look at the environment of safety that's built around you. It's truly a zone of incredible, meticulous control. Your journey inside the OR really begins with anesthesia. And broadly speaking, there are 2 main paths. You've got general anesthesia, which is where you're completely unconscious, and then there's regional anesthesia, which just numbs a large area of your body, and you might even be awake. The choice isn't random. It's a decision you make together with your anesthesiologist based on your health and the specific surgery.
Okay, here's something you have probably never, ever thought about during surgery: your body temperature. It is a huge deal. The team's goal is to keep you in a state called normothermia, which means keeping your core temperature within a very, very narrow and safe range. As you can see, even a tiny little drop can start to cause some real problems. Just how big of a problem? Get this. If your body temperature drops by just 1 or 2 degrees Celsius, your risk of getting a wound infection can literally triple. It can also lead to more blood loss and even change how your body processes medications. This is exactly why you'll see warming blankets and warmed-up IV fluids in the OR. They are simple but incredibly powerful tools for keeping you safe. Proper positioning on the operating table is another one of those invisible but absolutely critical layers of safety. The whole team works together to place your body in a way that gives the surgeon the access they need, while at the same time protecting you from any nerve damage. It's about simple things, like making sure your arm isn't stretched out too far, and using lots of padding at key pressure points. It prevents rare, but potentially devastating, complications.
So the surgery itself is done, but the safety journey, it is far from over. This next phase is all about being proactive. It's about heading off the most common problems that can pop up after surgery before they even get a chance to start.
So what's the #1 target here? It's the surgical site infection, or SSI. These are infections that happen right where the incision was made, and they're a really big deal. I mean, look at that stat. They make up about 40% of all infections people get in the hospital. They can keep you in the hospital for an extra week or more, so preventing them is, understandably, a huge priority.
One of the best weapons we have against these SSIs is giving an antibiotic right before surgery. But here's the kicker. It is all about the timing. Study after study has shown that for the antibiotic to work best, it has to be in your system within this very narrow window, ideally about 30 to 60 minutes before the surgeon makes the first cut. Any earlier or any later, and the benefit just plummets.
Another major risk the team is on the lookout for after surgery is something called a VTE, which is basically a blood clot. Because you're lying still for a long time, blood can sometimes pool and form a clot, usually in your legs. The real danger is if a piece of that clot breaks off and travels to your lungs. That's a life-threatening emergency. Because surgery automatically increases this risk, prevention is everything.
And that prevention is tailored specifically to you and your risk level. For patients who are at a low risk, it can be as simple as just getting up and walking around as soon as possible. But for people at moderate or high risk, the team will use a combination of tools, like special compression devices that squeeze your legs and blood-thinning medications, all to keep your blood flowing nice and smoothly.
All right, on to our final section, the path to recovery. The modern approach here is about so much more than just waiting to feel better. It's about actively managing your pain to help your body heal faster. For decades, opioids were pretty much the go-to for post-op pain, and while they work really well, they also come with some serious downsides. So today, the focus is shifted to what's called a multimodal approach. It's just a fancy way of saying we use a combination of different kinds of medicines, like non-opioids that reduce inflammation, along with opioids to get better pain control while using fewer narcotics. And this chart, wow, it really shows you why that shift in thinking is so critical. Just look at the difference here. For years, patients were sent home with way more opioid pills than they ever actually used. The goal now is to right-size these prescriptions, to give you exactly what you need to be comfortable while you recover, but nothing more. And this is the main takeaway I want you to have. Modern pain management isn't just about comfort, it's a therapeutic tool. When we control your pain effectively, you can get out of bed and start moving around sooner. And that early mobility is one of the single most powerful things you can do to heal faster, get stronger, and get home safely.
Which kind of leaves us with one final thought. When you look at all the checklists, the data, the precise timing of medications, it all seems like a pure science, right? But then you think about the teamwork, the expert judgment, the way care is customized for every single person, and it feels a lot more like an art. The truth is, a successful surgery isn't one or the other. It's that perfect, incredible blend of both.